Hello guys, good morning, good evening, good afternoon, wherever you are. Welcome back to this channel. Today's in pregnancy series, we are going to talk about Mola pregnancy. If you are a returning subscriber, thank you very much for always clicking in. And if you're watching this video for the first time, kindly consider clicking that subscription button and don't forget to turn your notification bell, because every time we post a video you will be the first person to be notified. So my name is Anbruka. We are taking you through pregnancy series. Any question you want to ask about pregnancy or reproductive health, feel free to write it in the comment section. So let's get into the video. What is molar pregnancy? So molar pregnancy result from problems that occur when sperms fertilize an egg. In a typical pregnancy, placenta form to nourish the growing babies. Placenta is the one that provides the oxygen, remove waste product, and many other things among the functions of placenta. So a placenta does not form normally in molar pregnancy. Did you get that one right? In molar pregnancy, placenta does not form normally and it doesn't work as it's supposed to work in a normal pregnancy. So as I have said, molar pregnancy occur when an egg and sperm join incorrectly at fertilization and create an uncancerous tumor. So what do I mean? I mean a molar pregnancy is a tumor. So the tumor look like a tiny water-filled sac similar to a cluster of grapes. The tumor can't support a developing embryo and the pregnancy ends. It can't grow up to term, so and therefore a woman cannot give birth when a woman is carrying a molar pregnancy. Some people have miscarriage. If it doesn't happen that way, if miscarriage doesn't happen, surgery is needed to remove the pregnancy. If left untreated, molar pregnancy can cause a severe complication. We are going to look at some of these complications and among other things that we're going to look in this topic. So molar pregnancy are typically gestational trophoblastic diseases. What did I say? I said molar pregnancy are a type of gestational trophoblastic diseases. So that means we have several types of trophoblastic diseases. And number one is molar pregnancy. Maybe in this pregnancy series we will look at those trophoblastic diseases that you're supposed to know. So let me explain gestational trophoblastic diseases. So gestational trophoblastic diseases, into bracket or GTD, is a group of conditions that causes tumor to grow in your uterus. Molar pregnancy are also called hydatiform moles. If you've ever heard somebody saying trophoblastic diseases and he or she is abbreviating it as GTD, that person is meaning gestational trophoblastic diseases. And also if you have happened to have had hydatiform moles, is also the same thing. It is molar pregnancy. So what are the causes? What are the types? Let us look at the types first before we look at the causes. So what are the types of molar pregnancy? We have two types: the complete molar pregnancy and partial or incomplete. So under complete molar pregnancy, in complete molar pregnancy, no embryo is formed. It happens when sperms fertilize an empty egg, and because the egg is empty, not the sperm. Because the egg is empty, the embryo cannot grow. Now the placenta tissue grows, but it is abnormal and contains fluid-filled cyst. So it can be fluid-filled cysts or tumors. So these tissues produces the pregnancy hormone, that is HCG. If you are a healthcare provider, you already know what HCG is, and that is human chorionic gonadotropin hormone, which is made by healthy placenta during pregnancy, and this can make you feel like you are pregnant and give you positive signs of pregnancy test. And we are going to look at positive signs, probable signs. Positive signs and probable signs. We are going to look at them in this pregnancy series, so stay tuned. Make sure you watch all these videos, especially pregnancy series, if you want to know anything about reproductive health. So the second type is partial molar pregnancy. We said we have two types, complete and incomplete, or partial. And partial molar pregnancy occurs when abnormal placenta forms along with an embryo and two sperm fertilize one egg, and in this case, or in these cases, the growing embryo has an extra set of genes. So in this form, the embryo may start to develop, and but generally it can't survive because of it is not normal. Watching this video and you are a woman, I know you are already wondering, who is at risk of getting molar pregnancy? Am I at risk of getting molar pregnancy? So stay tuned. Who is at risk of getting a molar pregnancy? Although molar pregnancies are rare, they are rare. Anyone can. If you're a woman, any woman can get a molar pregnancy. You are more likely to have a molar pregnancy when you are younger than 20 years. If you get pregnant when you're younger than 20 years. Also, if you are trying to get pregnant when you are over 40 years. Also, another one, if you have a history of molar pregnancy, whether you are the one who had suffered a molar pregnancy or anybody in your family has ever suffered from molar pregnancy. And also another one is if you ever had 2 or more miscarriages, those who like doing miscarriages, or those who like doing abortion, you are at risk of getting molar pregnancy. Yeah, those are the category of people who are at risk of getting molar pregnancy. So if you're under 20, don't get pregnant. If you are over 40, don't get pregnant, or get pregnant after consulting with the gynecologist. And also, if you have a history, you are likely to get pregnancy, you can go for gene consultation with your doctor, and the doctor will see or will reduce the level of HCG hormone in your body, and you will get pregnant at the right time. Molar pregnancy is 1% of all pregnancies in about 1,000. If we have 1,000 pregnancy, one must be a molar pregnancy. Did I say must? If we have 1,000 pregnancy, one might have a molar pregnancy. One woman might suffer from molar pregnancy. Get it right. I didn't say it's a must. So we are answering these questions. Can a molar pregnancy lead to normal pregnancy? Unfortunately, no. Molar pregnancy cannot lead to a normal pregnancy. The worst part of it will lead to loss of pregnancy. So what are the signs and symptoms of molar pregnancy? I know maybe you are somebody close to you has ever had these signs and symptoms, but if you really know these signs and symptoms, you always need to go to the hospital before it is late, before complications develop. Because if you develop complications, complication may lead to may make you to have to put complication may put your life at risk of other dangerous conditions. So we are going to look at signs and symptoms of molar pregnancy. Some people don't have any symptoms of molar pregnancy. For those who do, or for those who have some those signs, the common ones are vaginal bleeding within the first 3 months, the first trimester of pregnancy, severe nausea and vomiting because of increased level of HCG hormone in your body, also grape-like cyst coming out of your vagina, because that is a molar pregnancy. Maybe it's the pieces is trying to get out. And also you can have preeclampsia. Preeclampsia, this is a condition where a woman is having a high blood pressure and protein in urine, and also abnormal high HCG. You can have abnormal high HCG. This one you will get to know when you go to the hospital. Also, we can have abnormal abdominal swelling, and anemia can set in because you can have you will be having vaginal bleeding, and if not treated immediately, you will have anemia. So those are some of the signs and symptoms that somebody who is having a molar pregnancy will present with. So let's look at the causes of molar pregnancy. Let's look at the causes of molar pregnancy. So molar pregnancy are caused by genetic error that occur during the fertilization of an egg and sperms. In typical pregnancy, an embryo gets one set of chromosomes, that is 23, from each parent from this chromosome forms from each parents, and then you get a total of 46. A mother will donate 23 chromosomes, and the father also will donate 23 chromosomes, and we will have 46 chromosomes. So there will be a genetic error in this when fertilization is when fertilization is occurring, and maybe you might get that a mother is donating high or less, and therefore we will have more or less chromosomes. So that is about the genetic error. So the first cause is about the genetic error, and then also we have molar pregnancy contain an imbalanced chromosome. That is just something that I've explained. You might get that the mother is donating more or less, the father the same. So incomplete pregnancy, incomplete molar pregnancy, not incomplete pregnancy, incomplete molar pregnancy, the egg contains no chromosomes. The embryo gets 23 chromosomes from the sperm in a that is incomplete molar pregnancy, because we say that we had 2 types of molar pregnancy. So in complete molar pregnancy, the eggs contain no chromosomes. The embryo gets 23 from the sperms. So in partial molar pregnancy, an egg is fertilized by 2 sperms. The result is in the embryo having 69 chromosomes. You can remember I said the total chromosomes may be less or more. So in conclusion, we are going to say that genetic error may lead to incomplete pregnancy. So how can molar pregnancy be diagnosed? Your healthcare, this is not your work. This is the work of healthcare provider. This is the work of a nurse. This is the work of clinical officer. This is the work of a doctor. This is the work of gynecologist. This is the work of those healthcare providers. So your healthcare provider diagnose a molar pregnancy during a routine prenatal test. Usually in the first trimester, an ultrasound of your uterus often shows several filled sacs instead of placenta, because we said that molar pregnancy is will form a fluid filled sacs. So in when patients go for an ultrasound, when you send a client for an ultrasound, the ultrasound will bring a result of a fluid filled sacs instead of placenta. There is usually no embryo or fetus in your uterus, but sometimes pregnancy tissues remain. Yeah, pregnancy tissues remain because the fertilization happened. So maybe the pregnancy was trying to grow, and there is a genetic error in the during fertilization, and now your conceptional tissues may remain in the uterus. So your provider can also measure the HCG level in your blood. If it is higher than normal, or if it is higher than your doctor will expect, so maybe you are having a molar pregnancy. So let me say a healthy placenta produces HCG during pregnancy, and if it is higher in molar pregnancy, the HCG level will be higher compared to a normal pregnancy. Also, some people won't have any symptoms of molar pregnancy, and the diagnosis can be quite shocking. Just know that you did nothing to cause a molar pregnancy. In most cases, you can subsequently become pregnant with a healthy pregnancy you choose to. So how is molar pregnancy treated? Yes, that is another question. Is molar pregnancy treated? What are the complications that will set in? Yeah, we are going to look at those. So let us look at how is molar pregnancy treated. So molar pregnancy must be removed from your body, or it can cause severe complications or serious complications. Some people generally require surgical treatment to remove molar pregnancy. Treatment involve maybe the DNC, that is the dilatation and curettage, with sanction to remove all abnormal tissue from the uterus. Generally, anesthesia is given at this time, so you don't feel any pain during this procedure. In some cases, medication can also be given, help the uterus contract to expel the tissues. So you can talk to your doctor about the best treatment that you have, and the treatment will also depend according to a lot of things. It can depend of the severity of the molar pregnancy or the stage that pregnancy has reached. So in rare cases, hysterectomy is the surgical removal of the uterus may be needed. Yeah, in rare cases, it may be needed. I think especially when it stayed in the uterus for long, and it's interfered with the uterus. Maybe the uterus got started rotting, something of the sort. Maybe the doctor can recommend hysterectomy. So your healthcare provider will monitor your HCG level until it returns to normal, and therefore when it returns to normal, then you can also do gene counseling, and then you can get pregnant after 1 year of you getting molar pregnancy. So what are some of the complications associated with molar pregnancy? Occasionally, part of molar pregnancy remain in your uterus after surgical treatment or miscarriage. If this happens, abnormal cells may grow into the into the muscle layer around the uterus. This is rare. Is rare and happen in less than 15% of people who have ever had molar pregnancy. In very rare cases, molar pregnancy causes a type of cancer that is called choriocarcinoma. Choriocarcinoma form within your uterus and may spread to other parts of the body and may require treatment of chemotherapy or radiations. Yeah. So other complications may include sepsis, uterine infection, preeclampsia, that is high blood pressure with protein in urine, and shock may also set in because you can have severe vaginal bleeding. Anyway, I got distracted and now even the electricity is not there, so I'm shooting without lights. Okay, can molar pregnancy be prevented? There are no way to prevent molar pregnancy. If you have ever had a molar pregnancy, you can only reduce your likelihood of complication by avoiding another pregnancy for up to 1 year after your initial molar pregnancy. So talk to our healthcare provider about it when it is safe for you to get another pregnancy. So what is the prognosis for people with molar pregnancy? Most people who receive treatment for a molar pregnancy have no further complication. If you have a molar pregnancy, your risk of miscarriage doesn't increase. Yeah, you only at a likely high risk of a second molar pregnancy. Some people find it helpful to seek genetical counseling or gene counseling before conceiving again. There are not any indication that a molar pregnancy should affect your decision to try to conceive again if you wish to do so. So another question, does a molar pregnancy cause infertility? No. Fortunately, no, it doesn't cause infertility. However, you should avoid becoming pregnant for up to 3 months. This will allow your HCG level to reduce or to return to normal. Yeah, that is a very important point. So another thing that you have to know, if you are pregnant and experiencing vaginal bleeding, severe nausea and vomiting, or passing a grape-like cyst from the vagina, you are supposed to go and see the healthcare provider or your gyne or your doctor or anybody else. So anybody who is concerned with health issues or reproductive health issues. I think I've reached the end of this video. Let's meet in the next video. Pregnancy series is still continuing, but if I get any topic that I feel like I should talk about, I will be talking about it in the course of this series. Thank you for watching this video. Let's meet in the next video. Bye.